Hi, my name is Lucien Sankey, and this is a presentation of my literature review titled Clinical Informatics and Digital Health in the Integration of Genomics into Healthcare, my top 5 papers for 2017-2018. I am not currently employed in the health services field, but instead am in my first year of a Masters of Genomics in Health at the University of Melbourne. This is the very first time this master's course is being run at the University of Melbourne, and in fact the first course of its kind in Australia. With the rapid development and availability of genomic testing and its continued integration into many new areas of healthcare and well-being, it's an exciting time to be part of this emerging field. It is with this background that I chose the Clinical Informatics and Digital Health class. In the Masters of Genomics and Health course, we have spent a significant amount of time discussing genomic data, how it is used for both research and in the clinical setting, how it is stored and delivered to the patient, and the ways in which healthcare providers and the patients are able to achieve the greatest benefit from the information. We have also been looking into the ethics of genomic testing and genomic data. Of particular interest is how genomic data will be integrated into digital health systems and the ways in which clinical informatics will enhance the utilization of genomic medicine. The focus of this literature review is not on a specific digital health intervention, but instead on providing a snapshot of the ways in which clinical informatics and digital health are affecting the integration of genomics into healthcare. It is tailored to the Masters of Genomics and Health student with the intention of presenting current ideas about how digital health will impact the future of genomics, how patients will experience this change, and how this will affect all graduates of this master's course as they move into various areas of the workforce. An important aspect of the Masters of Genomics and Health course has been concerns of privacy and confidentiality, and this literature review also considers this aspect of digital health. This slide illustrates the search strategy used to gather the research articles for this literature review. My search included both the Embase and Medline databases and employed this advanced search feature of the Ovid databases using the search strategy listed. The Medline database provided 114 articles, and the Embase databases yielded 139 for a combined total of 253 articles. Duplicates were removed, after which I screened the remaining 183 articles by examining their titles and abstracts to determine if they related to the aims listed on the previous slide. The process left a shortlist of 25 articles for which the full texts were downloaded and more thoroughly assessed. The audience, the Masters of Genomics and Health students, were the principal factor when deciding on the top 5 papers, and while the articles are quite diverse and cover a range of topics, they provide an introduction to informatics and digital health within genomic medicine and are able to convey a sense of the current landscape and perhaps some future directions and possibilities. The next step of my review was to determine the rationale that would provide a thread tying these 5 articles together. One of the fundamental aspects of the Masters of Genomics and Health course is the consideration of the patient's perspective and an understanding of how genomics will affect the patient's lives, privacy, and health outcomes. It's not yet clear in what professional area of health a graduate of the Masters of Genomics and Health will be employed. So for this reason, it was important to take a foundational approach to the literature and the rationale. The top 5 articles needed to provide a good survey of how digital health platforms are integrating genomics and how electronic health records make use of genomic and hereditary health data in new and interesting ways, taking into consideration the patient's perspective and particularly the unique privacy aspect of genomic data. The rationale includes how data privacy was applied to research applications of human genetics and considers the future integration of genomic health into e-health systems. Given the research component of our Masters of Genomics and Health course, it was important that within the top 5 articles, both qualitative and quantitative methodologies were represented. Article 1, Evolving Healthcare Through Personal Genomics, was chosen because it sets the scene for the current state of genomic medicine in clinical practice and introduces ways in which informatics and digital health are able to connect patients with their genomic data. The paper highlights some of the challenges still facing the day-to-day integration of genomics and takes particular care to assess these from a patient's perspective. One example given in the article is the use of online databases for up-to-date and precise variant interpretation, i.e. understanding what is the consequence of a DNA change found in an individual. In the example, a hypothetical patient is visiting a genetic counselor to discuss her risk of breast cancer based on a family history and a pathogenic variant previously identified in her mother. The genetic counselor searches a centralized database called ClinVar, which stores information about genetic variants and shows that since her mother had been tested 8 years prior, the variant has now been reclassified as benign. This clearly illustrates how public genomic databases are an integral component of genomic medicine. The paper describes two different database strategies for genomic data, as the figure shows. In the centralized model on the left, clinicians and researchers submit their data to a single physically located database, such as ClinVar, as previously described in the last example, where the second is a federated model, where multiple physical databases exist that are located on different sites but are connected through an application programming interface. The author links the concepts of these database designs back to the importance of patient privacy and who has access to genomic data. While a centralized database offers greater uniformity of data and ease of access, it may sacrifice patient privacy. And as you'll see, this is a recurring theme throughout this literature review. Article 2 is a qualitative study investigating the reinterpretation of genomic variants, like the example from the previous article, and describes models for recontacting patients when new evidence becomes available. Very briefly, an example is where a patient undergoes some form of genomic testing and the results are inconclusive at the time. Sometime in the future, new information is entered into a public database regarding a pathogenic variant that was detected in that patient, raising the question of how and by what process should that patient be recontacted and be made aware of this new information, which could potentially have serious health impacts for that patient. The researchers interviewed 41 patients and in particular spent time addressing how information and communication technology involving the patient's electronic health record might be part of the solution. This paper fits the rationale well by focusing on the patient experience. It highlights the important role digital health may play in the solution and places significant importance on patient privacy, particularly because it concerns genomic data. The paper found that most patients felt that it was a joint venture and that recontacting shouldn't be the sole responsibility of either the patient or the healthcare provider. The article noted that respondents suggested that the most appropriate method for initiating recontact would be through an ICT system, and though not well defined, they felt that they should have access to their own electronic health record and that they could be alerted through this if there was changes in variant classification. This was illustrated by a quote from one of the participants, which appears on the slide. This article raised a significant issue in genomic medicine, that of variant reclassification and recontacting of patients, and suggested the important role that clinical informatics might play in a solution. However, this article would have been strengthened by a more deeper exploration of how recontacting patients may affect the entire family because of the hereditary nature of genomic information. Article 3 is a quantitative study which investigated the viability of using electronic health records to identify heritable disease in patients by determining the familial relationships. Taking a family history is the first step before a patient is referred for genomic testing. However, it can take a large amount of time and is often incomplete or incorrect. As a solution to this problem, researchers used over 1.5 million patient electronic health records from 3 major medical centers to construct family pedigrees and compute heritability estimates for 500 disease phenotypes. An example is shown here of the construction of patient pedigrees from one medical center. This was possible because not only do electronic health records contain a vast amount of medical information, they also contain emergency contact information, which is often a family member, and these were used to connect the patients and elicit a family history. Such a novel approach was able to provide a validated use of electronic health records to assist in genomic medicine and has the ability to be scaled to other medical centers across the US and potentially in Australia. This method was currently only used for research purposes, and the authors note that there is a significant bioethical consideration regarding the use of this method in the real world, including how best to balance the competing demands of protecting patient privacy with clinicians' duty to warn relatives of potential genetic risk. Article 4 explores the patient's perspective regarding the privacy of their electronic health record and the storage and use of their genomic data. This lengthy article, published in the Journal of Law and the Biosciences, explores the consequences of storing genomic data in a patient's electronic health record. As mentioned previously, in the upcoming era of personalized medicine, genomics plays a key role. However, this role does rely upon the sharing of genomic data so that advances in variant identification can be made. The article challenges the idea of what is meant by de-identified and how the meaning changes depending on the type of data. In particular, that the concept of de-identified genomic data may be much more easily re-identified than other forms of data stored in a patient's electronic health record. An interesting example is shown in the image, which is taken from a paper referenced in this article, in which computer-rendered facial images were predicted solely from a patient's genomic data. The close correlation between an individual's computer-rendered facial image and the portrait photograph is evident in the illustration provided. The authors conclude that the genomic data is different and unique compared to other health information and therefore should not be treated as de-identified. They suggest rather than legislation, there should be industry standard which should guide the sharing of genomic data, and that this should be transparent and disclosed to the patient so they are able to give informed consent to the way their genomic information is used. It was suggested that perhaps a patient portal in their electronic health record may be a solution to consenting how their genomic data is shared and used. The final article comes from the Yearbook of Medical Informatics and summarizes many of the ideas investigated in the previous 4 papers, viewing them through the specific lens of the patient's perspective. I believe this is one of the most important concepts when considering clinical informatics and digital health, particularly in relation to medical genomics. The introduction of new technology to capture health data opens up exciting opportunities in clinical informatics, but brings with it new challenges for managing that data, and this is particularly true for genomic sequencing. There are a range of obstacles that must be considered when dealing with genomic data due to the extent and depth of the information that can be extracted from it. This article describes the nature of patient privacy, the unique context with which each individual experiences it, and the importance of any future solutions being patient-focused. The author recommends that the privacy of patient genomic data should be led by patient preferences, and that there is an increased transparency of where that data is stored and how it is shared between researchers and institutions. The author also recommends that electronic health records support the portability of privacy. There is a lot of work regarding interoperability, but this should come hand in hand with privacy management. Above all, the author reminds us to view the issues of genomic health data and digital health through the eyes of the patient and not the informatician. Undoubtedly, genomic testing, genomic medicine, and the broader concept of precision medicine will continue to expand as we move into the future. It is an exciting time, however, it does pose a number of unique challenges, one of the most salient, as highlighted in this literature review, being the very nature of genomic data and how it must be treated differently than other forms of medical information. All 5 selected articles stress the importance and sensitivity of personal genomic information and the ways in which it is utilized in health informatics. It seems clear that a cornerstone to the success of precision medicine based on genomics is the ability for researchers to share genomic data, but this must be weighed against the privacy and informed consent of each patient and their families. The recommendation I feel is most important, and that was continually raised in my top 5 articles, and which I would impress upon my fellow students in the Masters of Genomics and Health, is the importance of investigating, understanding, and appreciating the patient's perspective. Consequently, many of the articles I chose not to include in my review had little consideration of the patient's perspective. This review also did not include any papers based in the Australian setting, as there is limited literature in this area at the moment, and while many of the themes and ideas are transferable, I believe more research needs to be undertaken to understand the Australian context and experience. The future will see a continued expansion of genomic testing in many areas of medicine and its integration into electronic health records. There seems to be strong recognition within the industry of the importance of ensuring patient autonomy, and this literature review has further strengthened my belief that the concepts around genomic privacy and the patient perspective are of the utmost importance. The final slide summarizes my top 5 articles and illustrates how they addressed my rationale. The students of the Masters of Genomics and Health will be the first to graduate from this course in Australia, and I believe that having an understanding of the important role digital health will continue to play in genomic medicine is imperative as graduates begin to join the workforce in a variety of capacities. While all of the articles included in this review looked at the interplay between digital health and genomic medicine, included in my rationale were the concepts of privacy and the patient perspective. The table shows that these concepts have been addressed comprehensively, and hopefully this presentation delivers a narrative which stresses their importance when considering what the future holds of how patients experience and benefit from genomics through clinical informatics and digital health. I hope this presentation has given you an understanding of the important role of clinical informatics will play in the future of genomic medicine and will help inform some of your own future decisions in your professional and perhaps personal lives. Thank you.